Hello, this is Dr. Marty Klein with more sexual intelligence. I'm a sex therapist, and so at least half of my patients struggle with shame. At our first session, when I ask, "What would you like to accomplish in our work together?" many people will often mention their fantasies, too weird, their desire, too low, too high, or their penis or vagina, which won't do what they want it to do when they want it to do it. Very few people say, "I want to feel less shame." Of course not. They're too ashamed. Some people, when they were young, were coerced into having sex with a priest or family member. They're afraid it means they're gay or that they secretly wanted it. Some are afraid that they'll sexualize their own or others' children, even though they have no interest in doing so. Some people were caught masturbating as kids. Some people like to smell panties or underarms or think about Hillary Clinton during sex, or they like being spanked, choked, bitten, or violated. Perhaps they've never told a living soul, and so they've never received any comforting nor reassurance that they're not the only one. Fantasies of sex with comic book characters, unicorns or dragons, that's common too. Of positions that no human body can accomplish. Of raping or servicing dead people. I have heard it all more than once. No matter what someone does, wants, or imagines sexually, they are not the only one. No matter how unusual, how seemingly deranged, how unsexy, how disgusting, no matter how illegal or immoral, no one is the only one. If the human mind can imagine it, lots of people imagine it, desire it, or even do it. Shame is the sense that one is morally defective. This puts someone outside the human community, and that's what's so damaging about shame. As a person hides or withdraws, they have fewer and fewer opportunities to receive compassion, validation, or support. They hear fewer of others' stories, which could be similar to their own. The ashamed are strangely narcissistic. Projecting their self-loathing onto others, they imagine that others think way more about them than they actually do. And they imagine that others focus on their deepest flaw, rather than wanting to engage them in talking about, say, their kids, their health, or their golf score. It's not a narcissism of conceit, it's a narcissism of anxiety. Shame helps explain why so many people with sexual dysfunctions withdraw from sex or from their partners. They feel they don't deserve pleasure. They don't want to pollute their mate. They don't believe their partner's stated affection or desire. Well, they're trapped in a prison of their own making, and many don't feel they deserve to be freed. When you're ashamed, satisfying sex, pleasure, connection, self-expression, adventure, seems like it's for other people. In contrast, most people who are ashamed feel they're only eligible for lousy sex or no sex. So, what does this look like in actuality? Well, consider George, so ashamed of looking at porn that he felt he didn't deserve his wonderful wife and he withdrew from her. Or Sora, so ashamed of gaining weight that she started calling her husband a sex maniac and refused sex with the lights on. Or Mitch, so ashamed of using a butt plug when he masturbated that he deliberately didn't use lube and hurt himself every time. And Reuben, so ashamed of getting turned on by wearing stockings under his everyday clothes that he wouldn't play with his beloved dog on a day when he indulged his fetish. For some, shame is a health issue. I have bisexual patients who won't tell their physician about all the anal sex they receive. I have patients who have several different doctors for several different medications, such as Viagra, an STD treatment, and high blood pressure, fearing that a doc who knows everything will judge and even gossip about them. I explain that sandbagging your own doctors in this way works against your own health, and I'm often ignored when I say so. So, what do I do with people struggling with shame? To be honest, I don't always succeed. I do try to help people see that they're suffering from a big misunderstanding, typically from long ago, either from misguided adults like parents, teachers, or clergy, or from their own decisions when they discovered their sexuality in adolescence or young adulthood, and their head exploded. Their pain is real. The disappointment, the outrage, the grief, whatever. Still, it's often just a long-term misunderstanding. That's why it's so crucial for parents to criticize what their kids do, but not to say you're a bad boy, or only bad girls hate their sisters, or God hates children who lie. And so I talk about the narrative process, that how we feel is not inevitable. It's constructed from assumptions that are often arbitrary and changeable. Sometimes that helps. Gail, for example, Gail came to realize that she was ultimately the one condemning her own masturbation, and that she could stop the unending reproaches even if her church didn't. Unfortunately, that approach doesn't always help. Mitch refused to consider that he had become his own ultimate critic, convinced that any reasonable person would find his interest in butt plugs disgusting. So when people are ashamed about their sexuality, I don't immediately talk much about sex. I talk about the misunderstandings of young children and of frightened or ignorant or compromised parents. I talk about the fear of discovery. I talk about the privilege of examining our narratives. I talk about self-acceptance. If we succeed in those conversations, sometimes the concern goes away because symptoms aren't symptoms anymore. And sometimes, yeah, we talk about sex. We talk about penises, vaginas, desire, orgasm. When you're able to welcome people back into the human race, that solves a lot of problems. Well, I'm Dr. Marty Klein. Thanks for joining me. I drop one of these little videos every 2, 3, 4 weeks, so check out my YouTube channel for a lot more of them. And don't forget to click the like button or the subscribe button at the bottom, and you'll hear from me the next time that I do drop one. Thanks for joining me.